Okay, good morning. And what's your name, young lady?
Michelle.
And how old are you, Michelle?
52.
52. And why did you come see me?
I sustained a L1 burst fracture, spinal fracture, February 14th in an automobile accident. In my recovery, I have been in a lot of pain with a limited range of motion. I'm due to go back to work July 1st, and I wanted to see if I could get my pain and my range of motion improved so I can do a better job.
Okay, now you're a registered nurse, you told me.
I am.
And you work in hospice. You work in homes with hospice patients, okay? And of course that involves bending and stretching and doing different things. And you've been on pain medication?
I have been on pain medication.
Now you broke your back. What did they do to your back after you broke it?
They did a spinal fusion from the thoracic. Oh my gosh, I just lost the number. 10 to lumbar 3.
Okay.
So they did a fusion there, and then they did a fusion laminectomy on L1. So I've got rods and screws.
Okay. And you've been in pain since then?
Oh yes.
Been hard to sleep?
Oh gosh, yes.
You can't get comfortable?
Cannot get comfortable. Sleeping has been a very big challenge.
Okay. And nothing to that. Okay. You've been on pain medication?
I have been on pain
And you were
medication.
concerned about going back to work?
Yes.
And being in pain?
Being in pain and not being able to do my job.
Okay. We treated you yesterday. How did you find the treatment?
The treatment was very easy. In fact, it was pretty relaxing.
Okay. It lasted about 25 minutes, although we spent about, 2 hours talking. We practice mind-body medicine. There's a mental component to every disorder, in my opinion. And so this is part of the treatment. We got through treating you, and you stood up. I told you to walk back and forth a few times. Bring us up to speed from then until now.
Okay. So after getting up, I was just kind of in casual conversation, walking around the living area. All of a sudden, I realized this is a new feeling, new sensation, no pain, absolutely no pain. And I actually shed a tear because it was such a relief. It's been 5 months, and I've been in excruciating pain. And as I was departing, 2 cute little dogs were out playing, and one came and dropped a frisbee in front of me, and without thinking about it, I bent over, picked up that frisbee, and threw it. And at that point, I knew that we were definitely on the right track, because I have not been able to bend over without being guarded, or even get to the ground without a lot of effort for 5 months.
And how did you sleep last night?
Amazingly well. I was a little tired when I got home, and I went to bed relatively early. Woke up.
You were relaxed when you got home.
That's it. I was very relaxed when I got home. I slept the best I have slept in 5 months, from probably about 8:30 to 2 a.m. I woke up at 2 a.m. just with bounds of energy, and I got up and actually cleaned my house for 2 hours, and then went and rested a little bit more, but woke up again and just feel fantastic today.
Well, this will be your second day, and we'll try to get one more at the end of the program. We're probably looking at 5 to 7 treatments for you, but you're a phenomenal patient. You listen, you do what you're told, and that's important, but it's working for you.
It is working. Thank you.
Thank you so much.